When testing hip abduction, the therapist is positioned behind the patient while holding the non-test limb in slight abduction. The therapist moves the patient through passive range of motion, instructing the patient, "This is the motion I want you to perform." The patient actively performs hip adduction if the patient is able to complete full active range of motion against gravity. Resistance should be applied directly down on the medial aspect of the inner thigh, just proximal to the knee. If the patient is able to hold against maximum resistance with no break, this is a grade 5 out of 5. If the patient is able to hold against maximum resistance with a slight break, this is a grade 4 out of 5. If the patient is able to complete full active range of motion but breaks immediately with resistance, this is a grade 3 out of 5. If the patient is unable to complete full active range of motion, testing should continue in a gravity minimized position. The gravity minimized position for hip adduction is supine. The therapist supports the weight of the testing limb and palpates the fibers of the adductor muscle group at the proximal inner thigh while the patient completes the motion. If the patient is able to complete full active range of motion in this position, this is a grade 2 out of 5. If the patient is unable to complete any active movement but a contraction is felt, this is a grade 1 out of 5. If the patient is unable to complete any active range of motion with no palpable contraction, this is a grade 0 out of 5.